an effort that really needs to be recognized and it needs to be supported. This $94,000 that we're providing to Pacific University will go to fighting and managing diabetes in a culturally sensitive manner for the Latino community. I'm going to say the same thing in Spanish, and then I'll introduce our main speaker. Mi nombre es Francisco Garballo y yo soy el gerente del mercado emergente para Regence Blue Cross Blue Shield, y el primer mercado emergente que hemos lanzado ha sido el mercado latino, y me da mucho orgullo para mí personalmente estar aquí hoy para poder entregar un dinero a la universidad para hacer una clínica que va a ayudar mucho a nuestro pueblo con una enfermedad crónica, diabetes, que en realidad no sabemos bien cómo cuidarnos. Y muchos de nosotros tenemos diabetes y creemos que es una sentencia de muerte, pero en realidad no es. Es algo que podemos vivir muy bien y muy cómodo con ellas. I would like to introduce our new president for Regence Blue Cross Blue Shield of Oregon. His name is Jared Short, and he used to work for Regence Blue Cross Blue Shield a few years ago and has just come back recently to assume the leadership position for this plan. It's a pleasure.
Thank you, Francisco. Good morning, everyone.
Good morning.
I have to tell you, I got the chance to talk to several of you this morning, and the amount of excitement around this grant presentation today is phenomenal. And I appreciate all of you coming today. This coming spring, Pacific University will be opening its interdisciplinary diabetes clinic. And if you think about diabetes, in Washington County, there's more than 30,000 patients currently with diabetes. If you couple that with nationally, 10% of adult Latinos currently have and live with diabetes. This clinic is going to be foundational in helping that population. If you think about the Regence Foundation, the foundation is really focusing on how do we improve health in our local communities. For the first 2 years of the foundation's existence, we've delivered more than $2 million to 38 nonprofit organizations that are all tied to how they improve and help their local communities and the health in those communities. And that's why we're here today, to talk about this diabetes clinic and the exciting opportunity it has to improve health. And so what I want to do this morning is invite up Dr. Halleck from Pacific University, the president, to come and talk about the diabetes clinic and what we expect from it.
Thank you, Jared, very much. I'm delighted to be here. I will not insult the Latinos in the audience by attempting to speak in Spanish. I am trying to learn, but I'm an old dog and it's taking me a little while. So I'll rely on translation. But this grant represents a wonderful partnership opportunity for Pacific and for Regence, if I may be so bold. Their commitment to the healthcare needs of the underserved dovetails very nicely with a long-standing commitment across all the healthcare disciplines at Pacific to instill in its students both the desire and the ability to treat the underserved in a culturally competent manner, but also to do so in a holistic and preventive fashion across the disciplines. And what I mean by that is that the students have built into their curricula things such as Spanish language competency, true interdisciplinary courses where the students study together across a range of disciplines: optometry, diabetes, optometry, physician assistants, dental hygiene, physical therapy, occupational therapy, pharmacy, the programs that have students work together. And if you know anything about healthcare education, it is much more typical to have silos of education than it is to have students come together across disciplines. The very design of this partnership was to make it interdisciplinary and culturally competent from the beginning. So these students will be working together across the disciplines to care for people who would not necessarily receive care in the first place, and certainly not across multiple disciplines in a culturally competent manner, with a prevention and management of chronic disease as the underlying principle. For me personally, it's an amazing opportunity to instill in our students right at the beginning the kinds of skills and the kinds of ethics that will serve them for their entire careers. So I thank you very much, Regence, for helping us launch this program. There was a news article that just came out, some of you may have seen the last 2 or 3 days, that said that the incidence of diabetes will double in the next 25 years and the cost will triple during that same period of time. So there couldn't be a more timely time to begin this partnership, and I thank you very much for helping us do that.
Dr. Howley, because of Pacific University's commitment to improving health in your community, the Regence Foundation is proud to present you with a check for $94,000 to start your diabetes clinic this coming spring.
Thank you so very much.